Hey everybody, Dr. Ross here from Invergrove Chiropractic. Just wanted to talk to you guys about a really important subject and some really big changes that have come up in that subject, and that is back pain. More specifically, we're going to talk about today is low back pain. One of the most common causes, or the most common cause for people to go in and visit their physician is low back pain. 8 out of 10 Americans have it any time in their lifetime. 25% of Americans in the past 3 months have had low back pain that's lasted longer than 24 hours, and it's a $765 billion healthcare industry throughout the whole year, which is a lot of money. And we're in a huge healthcare crisis, insurance-wise, with premiums skyrocketing and can't get into our physicians. It's really important to try to minimize those costs as much as we can and get the best treatment for our buck. So I really want to talk about these new guidelines that have come out with low back pain. Recently, the first things that we've done is people would go into their physician, get recommended with over-the-counter medications, which is Tylenol, Advil, Aleve, or if they needed opioid medications, so the bigger guns, the muscle relaxants, that kind of thing. What the research is showing and what the American College of Physicians has now published, and they changed their guidelines in the Annals of Internal Medicine, is that that is no longer the case. What is now recommended for all physicians to do if you have back pain, especially low back pain, number one is to not prescribe opioid medication. Opioids have a lot of side effects, and what they can do too is they can become addictive and can have a lot of long-term implications. The second thing is another not to do, and it is not to prescribe or to recommend over-the-counter drugs, such as the Tylenols, the Advils, the ibuprofens, the Aleves. What these do is they just kind of put a band-aid over the bullet hole and actually don't show any change in the studies that it's going to make you better any faster or save us any money. So what we really need to do is the third thing, which is what they recommend, is going to alternative therapies. And alternative therapies is a broad topic, so we're going to talk a little bit about that and what that you guys can do. So what the American College of Physicians has now recommended in the Annals of Internal Medicine is no over-the-counter drugs, no prescription drugs for the first-line therapy. If alternative therapies don't work, that's the route that we can go. But the different alternative therapies are chiropractic, physical therapy, massage therapy, acupuncture, personal training. There's a lot of different things that you can do to help get that low back better, not only in the short term, but to help keep that low back healthy for the long term, so this doesn't continue in this nasty cycle of pain, I'm better, pain, I'm better, pain, I'm better. So some of the big things that they suggested is exercise, and more specifically motor control exercise. And what that kind of means is it's talking about something called proprioception, which is the communication, think of, between the nervous system and the musculoskeletal system. So we need that communication to be in sync at all times. But what happens is when we have an injury, they kind of break that, and what happens is our movement patterns change, which is really important, because if a movement pattern changes and we continue with that movement pattern, what happens is our brain adapts, and then that is now our new normal, which is not a good thing. So what we need to do is identify those patterns. So with certain things such as functional movement screenings, different muscle testing, postural pictures, watching people walk, and these are all things that we do in our office, which is a great added bonus. So the second thing that they recommend is spinal manipulation, and that is one of the biggest things that we do here. The most important thing that we do here is the chiropractic adjustment. That's looking at the nervous system, looking at how the vertebrae are moving in your spine, and making sure they're functioning at 100%, and that includes the vertebrae, the musculoskeletal system, and the nervous system, so putting it all together. Another really important thing is acupuncture. We don't have an acupuncturist in our office, but we have a couple that we can refer you out to, and they will take great care of you. Really good at pain relief and also helping those muscles relax as well. Another thing that's really important is massage therapy or soft tissue therapy, and that is something that we also get to do in the office as well. There's some stuff that we do personally between Dr. Amy and myself, but then we also have Beth Ann, who is a wonderful massage therapist. And the really nice thing about her is that we can give her the advice of what's going on, and she can concentrate on those specific spots, which is really awesome. Another good thing that you can do if you have that low back pain is yoga. And yoga is really good for two big reasons. Flexibility, which is extremely important in our spinal health, but then also relaxation, meditation. We need to shut our minds off. What a big thing happens is when we do have low back pain, we kind of freak out and we're like, oh my God, what's going on? Because we're in a lot of pain, which is super common and it's a normal response. But if we're able to relax and calm our minds, we're able to make smart decisions, and we're able to return faster to whether that's work, playing with your kids, doing different sporting activities, whatever it might be. So we need to be able to relax that mind as well. And then another big thing is lifestyle changes. So usually there's something that we're doing that's going to cause that low back pain. So we can figure out what those are and do things such as exercising on a regular basis, eating a healthy diet, getting adjustments on a regular basis. There's a lot of different things. With meditation, it's really important to live that healthy lifestyle so that we can prevent these things from happening in the future as well. So some of the big things that patients ask us is, well, if I can't take those over-the-counter meds, well, what am I going to do to help with the pain in the short term? We just talked about the exercises, the chiropractic, the massage, all those will help that. But we actually have some nutraceuticals, so think of different supplements that we can do too. Not just changing the diet, but things that we can help supplement to help be a natural pain reliever, and then also anti-inflammatory. So there's a few different things that we can do. SPMs, which is a specialized pro-resolving mediator, kind of a big word, really good at targeting inflammation and settling everything down. We also have things such as turmeric, boswellia, quercetin, alpha lipoic acid, All these things are really good with helping with the pain, but then it's also good with helping with the inflammation, which we want to settle down. So that was a lot of stuff that we just went over, but all very important stuff. So what I really, really want you guys to do is to spread the message. There are new guidelines with low back pain. We need to stop taking the medications first and start doing the alternative therapies first. If those aren't working, and committing to some program, whether it's 6 visits, 8 visits, 12 visits, if then it is not working, that's when we start to bring in the over-the-counter meds or getting you to your physician and doing different things such as opioid medications, steroid injections. Those are things that we do after trying the alternative therapies. If you have any questions, please contact us. Our number is 651-451-1012. We would love to help you out, point you in the right direction, and then get you started to the recovery and get that low back pain to settle down so you can get back to your normal life. I hope this information really hits home with you guys and helps some of you. Please, again, spread the message. Have a wonderful day.